Now again, I'm going to go to meddling. Take a look at a brand new book that's out by two young people on the end of adolescence. I wrote an article about this in Business Week about a month ago. Rethink many of your core thoughts about your high schools and rethink many of your core thoughts about what it means to be young, because frankly, it ain't working. If you get a chance, if you have not seen, every one of you should encourage your state legislature as a group to watch the movie 2 Million Minutes. You can see it at 2mminutes.com. It is a film that takes 2 million minutes is 4 years of high school. It takes 2 years of, it takes 2 Indian high school students, 2 Chinese high school students, and 2 American high school students. And at the end of the movie, you will understand that we are aggressively preparing for the 1956 Olympics. There are no scores in 1956 that would work today. And so you got to really look at that and say to yourself, so how are you going to change things? I'll give you one no-cost example. All of you could go back home and pass the following bill. It would cost your taxpayers nothing. Any student who can graduate from high school in 3 years automatically gets the 4th year's account as a scholarship. Any student who can graduate in 2 years gets 2 years of a scholarship. This costs you nothing. If you can graduate in 1 year, you get 3 years. Now what it does is 2 things. It totally breaks up the current mindless Carnegie unit curriculum structure that basically says, I don't care how bored you are, we're not covering that till Wednesday. And it recenters the school away from football and away from the prom and puts the school back to focusing on learning and rewards the kids who learn and doesn't cost your taxpayers a penny. But it fundamentally changes the underlying value structure of going to school. And you could do that in January and it wouldn't cost you a dime, and within 2 years you would have fundamentally reshaped what kids pay attention to. My daughter Jackie Cushman just did a project. We're actually looking for a foundation to help us do it again. But a good friend of ours gave 50 grand, and they took 2 very poor neighborhoods in South Fulton, and they paid the poorest kids the equivalent of working at McDonald's to do their homework. And they had a dramatic impact, because guess what? It turned out really poor children respond to money. I know this is bold. I know it's out on the edge. But it turns out they watch rock stars and rap stars and baseball players and movie stars, and they see negotiations and they see how much people get paid, and then we tell them, but you ought to be happy because we're going to give you a piece of paper with 3 letters on it. And they're poor. And again, all of you could go and look at taking 1 or 2 neighborhoods in your state for almost no money, pay the kids and see what happens. It's a lot better than sending them to jail. And that's what we're doing to them today in poor neighborhoods. A couple last big points. On health. First of all, Senator Judson Hill is here. He is somebody I recommend to all of you. We worked with Judson for the last 4 years in Georgia. He's done a remarkable work on transforming Georgia. We are launching at the Center for Health Transformation, which you can see at healthtransformation.net, a health-based health reform model that I'd urge all of you to try to get your committee, whatever committee you have on health in your state legislature, should look at health-based health reform. Simple model. The Gunderson Lutheran Hospital System in La Crosse, Wisconsin, is the least expensive place in America for the last 2 years of life, according to the Dartmouth Health Atlas. It costs $13,600 for the last 2 years of life in La Crosse. It costs $58,000 at UCLA. They have a higher satisfaction rate than UCLA. Families feel better about the experience. And they do 4 things. Over 90% of their patients have an advanced directive. They have an electronic health record, so the staff knows what the directive is. They have palliative care, so they take care of people who are in pain. And they have hospice care. Now, if you simply went out and found the best practices in your state and insisted that over the next 3 years, all the hospitals and doctors would migrate to best practices, you would take out virtually all the cost increase in Medicaid and in your state employee health cost. But it's a new model. It's a model that says don't cut across the board, don't use a meat axe, accelerate the adoption of the best practices to lower the cost and improve the outcome, which is what we historically have done in manufacturing for 200 years, but we don't do in health. So it's a fundamentally new model. Second, let me go back to honesty. The New York Times reported a couple years ago in a 4-part series that Medicaid in New York is 10% pure fraud. Not waste, not abuse, not judgment, but a dentist who filed 972 procedures in one day. A dental office which had a person standing out front who said, if you'll loan us your state Medicaid card for 30 seconds, we'll give you a free DVD player. Now, we have had no serious effort at taking fraud out in this country, and I'm not saying this is true of every state, but there are a lot of states that would save billions. New York State, by the way, 10% is $4.4 billion a year in fraud. And Jim Froeg, who's here from the Center for Health Transformation, many of you know Jim from over the years, Jim would be eager to work with you on Medicaid reform because we think there's a ton you can do there. The third point I'd make is, both for Medicaid and for your state employees, go to incentivized systems. Allegiant Hospital System in Omaha, Nebraska has 93% of its employees now signed up for incentives. So if you're diabetic and you're compliant, you get rewarded. Every person does an assessment of their health every year. Every person is rewarded for doing well. They're not rewarded for not doing well. They've had a very big impact on the cost of health care for their employees. They have 9,000 employees. But all of you should have an incentivized system for health so that every person knows their own health status. Every person is involved directly in minimizing their cost. Finally, you look at community-based models. We have a project in Columbus, Georgia, which Laura Lynn and the Center for Health Transformation has undertaken on diabetes and on obesity, which we'd recommend you look at. There's also a great project in Oklahoma City where the mayor, Mick Cantor, decided that or Mick Cornett rather, decided that he would never lose weight. He'd always been 40 pounds overweight. So he announced last January that the entire city would now lose weight. He has had a citywide project on diabetes and obesity, and the city, as of September, had lost 176,000 pounds. It is a great case study that all of you ought to look at, because obesity and diabetes is now probably the largest single health problem we have in the country. It's really worth your looking at. Let me just say two last things, and I'll get out of your hair. Part of our economic change has got to be energy. We are developing at American Solutions an all fronts energy solution. We wrote a book called Drill Here, Drill Now, Pay Less. Many of you know that at American Solutions we launched the petition drive, Drill Here, Drill Now, Pay Less. This is the first time in 27 years that it's not illegal to look for energy offshore. My wife Callista and I did a movie recently called We Have the Power, to make the 2 points. First of all, we have the power as the American people to change government when it's stupid. But the second is, we don't have an energy problem. We have a policy problem. We have 27% of the world's coal, and left-wing environmental groups are now running ads against coal. We have 3 times the oil reserve of Saudi Arabia in oil shale in Colorado, and the Congress made it illegal to develop it. We have, in deep shale, 1,200 years supply of natural gas. We have new technological breakthroughs in electric vehicles. I recently drove the Tesla in San Jose, California, an electric car, a sports car, which goes 0 to 60 in 3.8 seconds and is faster than any internal combustion car except the most expensive Ferrari. We have breakthroughs in solar, breakthroughs in wind, we have breakthroughs in hydrogen, and we have government policies that are just stunningly self-destructive. We're developing a project on clean coal being transformed so that you capture the carbon and you use the carbon for enhanced oil recovery. And there are 100 billion barrels of oil in American reservoirs that cannot be gotten out at the current pressure that you could get out if you had enhanced recovery. So you both get clean coal, which is cheaper, and we have 27% of the world's supply, and you get to recover in America oil so you don't have to buy it from Saudi Arabia or Venezuela. There are so many things we could do if we were determined to do it, and I would hope all of you would look seriously from the standpoint of your state. That also means you've got to rebuild the electric grid, because I keep telling all of my left-wing environmental friends, if you want people to drive electric cars, there has to be electricity. I mean, it's, look. I know I've always gotten a reputation for being out on the edge, but it's pretty important.